Hi, my name is Carrie Perkypile, and I am the nurse practitioner here at Primary Care Partners. With all the recent COVID-19 developments, we've had a lot of questions from our patients, so we'd like to take some time and answer some of these questions that you have. First, we received a lot of questions regarding, do I need to wear a mask when I'm out in public? And the answer is yes. The current Center for Disease Control guidelines and recommendations do recommend that you wear a face mask when out in public. This can be as simple as a bandana or a homemade cloth mask. Another question that we received was, can I have symptoms without having a fever with COVID-19? The answer is yes, probably. The reason why I say probably is because fever is the most common symptom with COVID-19, as is cough. But we've also found that there are a variety of other symptoms as the virus has come to more light. This can include body aches, even GI symptoms such as nausea and diarrhea. Another question was, once I get home, what do I do with my groceries? Do I need to wipe them off? What can I use to clean my home? As we all know, when we go to the store right now, there are a few cleaners that we can't get or there's such limited quantity. One, the Clorox wipes are a great thing to use, but nobody can get them right now. And if you can, you're pretty lucky. So, what you can use at home. Of course, washing your hands with hot soapy water is the best thing you can do. When you get home from the grocery store, wash your hands. Take your groceries out of their bag. What's recommended currently is not using reusable bags because of the transmission of the virus. So dispose of your plastic bags, your paper bags by recycling or discarding them. Next, wash your hands again. Touch your groceries, remove any outside packaging that the groceries may have come in, such as a carton of apples that maybe you picked up at the store. Remove them. Wash the fruit or the vegetable and put it away. If it's something that maybe when you went to the store it had the possibility of getting touched a lot, or you saw it getting handled a lot, or maybe you don't need it for a few days, if you can keep it somewhere away from your family and where you're going to be touching it, such as your garage or your basement for 2 to 3 days, that can also reduce any germs on the outside. But for the most part, do the best that you can. As far as cleaners go, I would urge you to go to EPA.org. What that has on its website is the Environmental Protection Agency. They have a list of all the approved cleaners that kill COVID-19. This includes, but is not limited to, bleach, such as Clorox bleach, isopropyl alcohol dilution, and hydrogen peroxide in a dilution. Another question that we have received is, why do more of the adults or older adults seem to be getting more sick than children? So the answer to that question is this. Most people over the age of 65 do have some other medical problems, such as what we call comorbidities. These can include, but aren't limited to, diabetes, especially uncontrolled diabetes, heart and lung problems like COPD or uncontrolled asthma, heart disease as well, not to mention obesity. Children, on the other hand, while they may have some of these comorbidities or illnesses, they are usually not as sick and don't have so many of these medical problems that the older adults do. Another thing to consider is that as the aging population continues to age, a lot of them may end up in a long-term care facility such as a nursing home or assisted living, where there are a large group of people in a small amount of space. On behalf of Primary Care Partners, I'd like to thank you for viewing this video and for also keeping us in mind for all your healthcare needs. Don't hesitate to call us with any questions or concerns, and again, we are here to take care of you at any point in time.